Hello, my name is Louise Isham. I'm the Senior Executive Coordinator for the Bois Forte Tribal Government. Today we're going to be doing a quick question and answer session with to kind of cover the basic questions of masks. And with that, I have Dr. Shanna Vidor and Teri Morrison, who's also a registered nurse. You want to wave and say hi?
Hello. Greetings.
Greetings. All right, I'm just going to get right to it because everybody's time is really precious here. So our first main question that I want to share or ask is, how is the COVID-19 spread, and is it airborne?
So this is a really big question that everybody's been asking, and right now the primary way that they've discovered its spread is through respiratory droplets. So these are a little bit larger, I guess, droplets when somebody coughs, sneezes, and so those are the biggest ways that this is getting spread. That's why we're asking people to do the social distancing, maintaining 6 feet between people, covering their coughs, covering their sneezes, washing their hands, deep cleaning or disinfecting hard surfaces to try to keep any of those droplets that may have settled down or off completely. As far as is it airborne, there's a little bit of discussion about that. Certainly if it was in an aerosol generating procedure, so something done in a hospital where very, very, very fine respiratory droplets could be produced, not the bigger ones like from coughing or sneezing. There's a potential that those could be a little bit more present in the air for longer, but they are not at this time saying that it is airborne or that it's spread primarily by airborne aerosolized particles.
Okay. Okay, our next question is, is it safe to go outside without a mask?
It is safe to go outside if you're not out in the public. So if you're in your yard, if you're going for a walk, and if it's just you or your household members with you, then yes, it's safe. If you are going for a walk and your neighbor wants to stop and talk to you and they're within that 6 feet, then you need to remind them to back up. We just put out a recommendation for Bois Forte community members that we recommend if they're going out in the public, like the grocery store, or something, that we're asking or recommending that they wear either a surgical mask or a homemade mask. And that is just to kind of possibly provide some protection for them and then the other people in around them. But going outside, going for a walk in your yard, going for a bike ride, bringing your dog for a walk, that kind of stuff with your family members that you live in the same household with is safe.
Okay. So I guess that brings us to our next question, is like, should I wear a mask whenever and wherever just to be safe?
So this is something that's definitely kind of been evolving, especially here in the United States as we've gone forward. Right now, the CDC and the Minnesota Department of Health have not made a widespread recommendation that everybody should wear a mask if they're going out, that kind of stuff. I think just in general, to reduce respiratory droplets, it's a good idea to put on a mask, especially if you're going to be going out in public. If you do have to leave your house to go do a grocery run or something of that nature, and you do have a mask available to wear, it's reasonable. And they're talking about things like homemade masks, bandanas, those kind of things. They're asking people in the public not to be using the N95s or the surgical masks because they are in such high demand, and it's really, really important that those are available for healthcare providers, especially if they're going to be in a situation where they're going to be exposed a lot more frequently or a lot more closely to people that may be ill with the virus.
Okay, so I mean, you did mention types of masks. Is there really a big difference between the surgical and then just like those masks, templates and videos on how to make your own at home? Which one should I wear? I mean, just a bandana or?
And I'll give this question to Teri.
Oh, okay.
Okay, so if you have access to your own supply of surgical masks, right now you cannot buy them anywhere. So if you have them at home from in the past, if you had it before, then if you have a surgical mask, that's fine to wear. Your choice would be surgical mask and then a homemade mask, which is just usually about 2 layers of material, and it goes behind, it has loops that go behind your ears. That would probably be the second choice. And then if you don't have one of those, then you could do a bandana or a scarf that you just tie around just to cover the droplet spray coming out. Those would be the ones that I would recommend.
Okay.
For the general public. Those are not medical. Those are not personal protective equipment. That's what PPE we call it for healthcare workers. Those are not recommendations for healthcare workers. Those are for the general population.
Okay, cool. So like you said, so where do I get the masks for my family? Do we just, like you said, to use a scarf and just, I mean, I see a lot of people making them. Should we just make our own? Is there a specific type of cloth or something we need to use?
Okay, so I'm going to I think I'll send you something for a link for the cloth because I'm not 100% sure on that off the top of my head. I think it was a tight weave cotton or a cotton polyester blend, I believe, but we'll post a link in the comments on this.
Okay.
So like I said, if you have the surgical masks at home without stealing them from a healthcare facility, please don't take them from a healthcare facility because the healthcare workers need them. There's a huge, huge shortage. So if you have those already, then use those. If your next option would be to make a mask yourself. If you're not able to make a mask yourself, try to see if you can find someone that sews or a family member. I know we're working on a collaboration up here for Bois Forte for the employees and the community members. We're asking for donations. So if you do know how to sew, we're working on buying some fabric. Some people already have fabric. We've gotten some donations. We kind of need to see how many donations we actually are able to get in before we can figure out how we're going to dispense those out. They're going to go to employees, I believe, first, because we're here, we're around each other all the time, and then we're going to work out from there with elders and community members after that. If you're very handy, please sew your own. Please try to locate your own. I did log in, for those of you that like to online shop, I did go into Etsy this morning. And they were priced anywhere from $7 up to almost $30. So there was some available on Etsy. I'm assuming that there still would be some on like eBay and stuff too if you wanted the homemade ones. Those are homemade. It's hard to know what you're getting, but that would be an option if you're wanting to get some.
Okay, well, thank you. I guess that's pretty much answers our big questions. Is there anything else you want to share regarding masks or how to use them or any of that? Please do so.
I just want to add that the biggest thing, you know, with everything that we're trying to do, whether it be masks, social distancing, disinfecting hard surfaces, hand washing, we're trying to reduce the amount of virus that's present in our environment or present from contact that can, you know, then cause infection. So mask wearing is a piece of this. We do want people to be careful not to be touching at their face while they're wearing their mask. So if you're finding that you're spending a lot of time adjusting the mask or touching at your face, we're going to want you to be, number one, hand washing, and number two, you know, maybe consider a different mask or a different fit if you find one that's not, you know, working and you're having to adjust it frequently. We also do not want people to use a mask as a security blanket, so to speak, or a reason to then just go out in public. That's not how these should be used. They're an added layer of protection potentially if you do have to go out. So we want people to continue to stay at home wash their hands frequently. If they do have to go out, wash their hands in their home too, especially. You know, cover their coughs and sneezes, whether they're in their home or out. And then, you know, practice the social distancing and the disinfecting of the hard surfaces. So all of these things together, they work together to try to help reduce the potential risk for infection in the home and in the community. So, you know, again, having a mask is an added layer to the things that we're already doing. But it can't by itself, it's not sufficient to protect.
Okay. Well, thank you. Well, I guess that's pretty much all we have for our questions regarding masks today. I just want to say thank you to both of you for spending time with me and answering any of these questions. And we'll see everyone again next time.
Thank you, and everybody keep up your good hard work and stay well.